We're going to move on to some intraoral procedures. We can affect the branchial arteries or the tissues derived from the branchial arteries intraorally. The tongue, for example, we got cranial nerve 7, we got cranial nerve 9, 10, 11, and 12. Quite a few cranial nerve 5. So there's quite a few cranial nerves just involved with the tongue, and of course the root of the tongue goes right down into the epiglottis almost. We talked about periosteum in the mandible. Can we bend the mandible? I think we can flex the mandible somewhat if there's chronic pain. Talking about joints, temporomandibular joint, we're going to mobilize that. We're also going to talk the dental alveolar joint, or the tooth, the chronic toothache. Maybe that has a problem with the non-vascular edema at the root of the tooth. Can we affect these subjects? Can we affect these conditions? Sometimes I think so. Okay. So we'll start with, well, the jaw. Suppose you got a sore jaw. Okay, well, maybe we can change the periosteum somewhat. So I'm going to try and bend your jaw. Okay. So I'm trying to, now you got to tell me how that is on your teeth. Mandible, underneath. Sorry about that, quite tender.
Yeah, it can be.
Or underneath, better grip, watch the teeth. Flexing the mandible. Toothache of an unknown origin. We'll go in the upper tooth. This tooth right here, say. I know it's difficult to see, but I'm just going to move that tooth. Pressure this way. Pressure the other way. Pressure this way. Too much, pressure the other way. Pressure this way. Pressure this way. Maybe move the tooth towards your nose, rostrally, or maybe backwards. Feel that in your root?
Mm-hmm. Yeah, my teeth.
Why can't you load a tooth? Why can't you load a tooth? The sphenomandibular ligament goes from the mandible to the sphenoid, and that goes into the inner ear as Meckel's cartilage is part of the first branchial arch. I want to traction that, I want to load that. And close a little bit. And lower the table. So I want to pull the jaw joint down this way. Close a little bit and pull down. And pulling and relax. Feel that jaw going down?
Mm-hmm.
That's a weird feeling, eh?
Mm-hmm.
So I'm actually tractioning that jaw. I'm tractioning the jaw down. Inside again. And close. You all right?
Mm-hmm.
Now, can you move your chin side to side? Okay. Turn your head that way a little bit. Open your mouth. And move your chin towards me. And relax. Now I'm pulling the TMJ, the temporomandibular joint this way. Pull and relax. Teeth all right?
Mm-hmm.
You got to be very careful of the teeth, of course. There's ways you can move that with your hands not in the mouth. But this is quite effective. Trigger point. Trigger point. Okay, open up and close. I'm going right in the back, hitting the trigger points into the masseters and the really deep in the pterygoids. Pretty tender, eh? Mm-hmm. And you can open it a little bit. Okay. Open again. General jaw mobilization, just relax. Just let it go. So I'm pulling, pushing side to side. Some torque.